This is Dr. Sajid Maqbool one more time. We spoke about the common cold the last time, and I mentioned that this is a little bit of an infection of the nose and the throat with a little bit of fever, and this gets better. Now, when you look at the lungs, you could think of it like an inverted tree, with the trunk being the main breathing tube and then the branches being the smaller breathing tubes, and the leaves being what we call the air sacs, where the carbon dioxide is exchanged for oxygen. Now, sometimes the lungs are affected, not so much the nose and throat, and this is a condition that we call pneumonia or inflammation of the lungs. Now, this is a very serious condition, and it is the commonest cause of death in children in Pakistan and other countries, more so than diarrhea is. So what happens in this condition is that it starts off with the cough and maybe a bit of a runny nose, but then there is fever. So shortness of breath comes next. A child starts breathing very rapidly, so much so that he's making an effort to breathe, and his nose seems to be moving when he's breathing, and sometimes he becomes very lethargic. He's not able to eat or drink, and sometimes even the lips or the hands may turn blue. So the child becomes quite uncomfortable over a period of a few days. This occurs primarily because of an infection, mostly from viruses. And viruses, I have mentioned, are small organisms, smaller than bacteria, but both bacteria and viruses cause this. Now, as opposed to the upper respiratory infection, the cough and cold, which is caused only by viruses and may not require any antibiotics, this pneumonia may be caused by viruses as well as bacteria, and we presume that it is caused by bacteria, and therefore we need to treat this slightly differently, and we do use antibiotics. So first, the child is generally examined by the physician, and then after that there will be a number of tests that may be necessary. One invariably is a blood test, and of course the most important is the chest x-ray. And after that diagnosis of pneumonia is established, then you need to take the child for therapy, which means if the child is very severe, then you have to give intravenous antibiotics and intravenous fluids, and may actually have to be hospitalized. If the pneumonia is not very severe and the child is fairly comfortable, then the antibiotics can be given by mouth. And generally, we are talking about 5 to 7 days of duration. Fever medicine for if the fever is very high is also given, and some cough medicine may also be prescribed. Now, this is a serious condition, and one needs to worry about it. It needs to be treated, but if treated properly, it does respond. So one is to avoid it, and that is to try and avoid contact with other people who have similar sicknesses, which is sometimes difficult to do for children. Fortunately, there is a preventive measure which is called the immunization or the vaccination, and that is against pneumonia. It is given very early in life at 2, 4, and 6 months in the first year, and then one booster shot is given at about 15 to 18 months. Now, it is also available in the expanded program of immunization that the government has, and it is totally free, and there it is given at 6, 10, and 14 weeks. So pneumonia is a serious condition. It comes from viruses or bacteria. Child gradually becomes short of breath and has fever and becomes lethargic, not being able to drink, etc. And after examination and a chest x-ray, the child will need antibiotics and proper care. But most important again, prevention is always better than cure.